Well, warm welcome to today's update, Tuesday the 29th of March. Now, I want to look at the incredibly high prevalence in the UK today. Nationally, about 1 in 16 people, actually probably higher than that now, currently infected. This is the very high prevalence. In Scotland, it's 1 in 11 people are currently infected, or even slightly higher than that. Amazingly high prevalence in the UK. And we've got some detailed data that looks at that. Now, but I want to start off with some international context here. Now, here we have the number of cases per million. So Canada and the United States are very low, although we know there's limited testing there, but we do know that hospitalizations in the States, for example, are low, which is good. United Kingdom shows a modest increase. Now, there's no other ways to put this. This line is absolute rubbish. It doesn't represent reality at all. Contradicts the Office for National Statistics data, contradicts the COVID symptom tracker data. So we know that is a massive under-reporting. No question about that at all. Now, this is Germany here. Now, German cases have been up, but now they're going down. This is New Zealand, but this is Hong Kong here. And look how high Hong Kong has been. Quite incredible peak in cases in Hong Kong. Due to Omicron, of course. Very, very high levels there in Hong Kong. Let's look at how that is transposing into... here we see how that's transposing into hospital patients. And unfortunately, we don't have the Hong Kong data, but we do know it's very high. So United States, Australia, hospital cases are going up slightly. Canada, they're going down. And the UK, they're going up. Although the Secretary of Health has said that about 60% of these cases are incidental. They're people that have been admitted for other reasons who happen to test positive when admitted. So not quite as bad as it looks, but still a definite increase in hospital cases. And here we see new daily COVID confirmed deaths. Now, I've left the whole pandemic on here. So we've got that's pretty well a first wave, a second wave, a third wave. And depends on the countries how you count the waves, of course. But here we see Hong Kong. And there's no two ways about it. There has been a massive, massive spike of deaths in Hong Kong. Now, thankfully, it is starting to go down. But for this short period of time, the deaths in Hong Kong way higher than anywhere else that has been recorded anyway. And why is this? Well, this is the combination of very, very transmissible Omicron combined with relatively low vaccination rates in the older, more vulnerable groups, combined with a virtual complete lack of natural immunity from previous viral waves because they've been so effective at containing the outbreak in the past, as they have in mainland China. So in a sense, this is almost viral payback time for them controlling the virus so well. So remarkably high death rate, but for a short period of time. And let's hope that does really come down quite quickly, so it's not a wide period of time. Now, let's move on to the United Kingdom now generally. Now, I want to start off by looking at the COVID symptom tracker data, which is here. Now, unfortunately, this isn't being funded by the government anymore, but they're managing to keep it going for some time. The funding is going to run out at the end of this month. But we see that the current prevalence is 4.3 million people currently infected. New daily cases, 350,000 symptomatic cases. And here we see the prevalence graph, and this is bang up to date. This should be for, is that the 29th or the 28th? That's the 28th, but we see there 4.3 million. But it's still going up. Now, the rate of increase has probably started to level off a bit there slightly, but still going up remarkably quickly. I mean, this is just absolutely incredible, incredibly high prevalence rate. Now, I do want to look at the Office for National Statistics data in a minute, but let's just start off with some of the UK summary data as well here. Now, here we see the cases, which we know we can ignore, that they're a massive underestimate, so there's no point going there. But even on the official cases, we do, having said that, we do see quite a big increase even on the official testing cases, even though we know it's a huge underestimate. Healthcare, of course, is the key parameter that we need to keep an eye on here. So patients, the first one there is patients admitted to hospital. Of course, that's going up. So I guess we could now call this wave here, I think it's fair to call that wave there the BA1 Omicron wave. And this is now the BA2 Omicron wave. I think we can say that without being too simplistic about it. That double wave, as we see that on the full scale of the pandemic. But lately we do see hospital admissions definitely increasing. Then patients in hospital, and again we see a similar pattern. And again we are seeing the two waves really. I think we're seeing the two waves of Omicron, the BA1 wave here going down, and then the BA2 wave there. And we noticed that that was starting about January, early January. But patients on mechanical ventilation, again, it's gone down since Omicron started. But there is a slight uptick now, I think, and it's due to the sheer high numbers of people. Now, some of these, of course, will be incidental admissions, people admitted for other things. But it's just due to the such high prevalence numbers that we have at the moment that I think explain that. Now, let's go on and look at the Office for National Statistics. So they're the references we've used so far. Just before we do that, we'll look. This is a national event today in the UK that gives you, if you're outside the UK, this just gives you a tone of what's going on. So basically, it's as if COVID doesn't exist in this country now. In England, at least, there's no restrictions. In Scotland, there still are some. But this was the memorial service for the Duke of Edinburgh, rightly, today in Westminster Abbey. And of course, people were singing. It looks like one lady's got a mask on there, but I can't see any other masks at all. Combine that with singing, 2,000 people, all in a small space. The great and the good. I think we can assume that at least 1 in 20 of those had COVID. 2,000 people there. Work it out for yourself. This is a guaranteed super spreader event. But you could argue that this is good because it's spreading natural infection everywhere. Therefore, it's spreading natural immunity everywhere. And again, this is in the context of a very highly vaccinated population. I thought that was quite an interesting illustration, really, of what's going on in the UK at the moment. Now, let's move on to a little bit of information about the Office for National Statistics here. Percentage of the population that had COVID up to the 19th of March, so 10 days out of date. And according to the COVID symptom tracker data, which of course is up to date as per yesterday, it's still going up. How much higher can this go? I think the answer is not much higher. I really think it's got to be peaking out pretty soon, but it's staggeringly high due to the massively transmissible Omicron BA2, pretty well as transmissible as measles. Quite incredible. But thankfully not very pathogenic. And if you live in the UK now, you know several people, or you yourself, could have been diagnosed. I've had a bit of a cold. I'm still testing negative, but I'm going to keep an eye on that. I think I may well have it now, actually, but we'll see if I get a positive test in the morning. But relatives, friends, we all know dozens of people with it at the moment, just because it's just such high prevalence just now. So this is, as of 10 days ago, 1 in 16 people in England, 1 in 16 people in Wales, where there's been stricter restrictions, Northern Ireland 1 in 17 people, and Scotland, where there's been stricter restrictions, 1 in 11. So we see that the mask wearing and the nominally stricter restrictions in Scotland made no difference. In fact, you could argue it's made it worse. There's a temporal correlation that it's made it worse. So Nicola Sturgeon said something that I have to be prudent or something. Well, this is what we said. We've been saying this on this channel. Omicron is not stoppable any more than the tide is. I don't believe we can stop it, and that just shows that the public mask wearing in Scotland made no difference at all. Antibody prevalence in the UK, 99% in England, very high, all good. More people than that have actually been exposed or been vaccinated, but that's the current antibody prevalence. Of course, people that have tested positive in the past will have dropped below the detection threshold for the Office for National Statistics national survey. Wales, basically the same. Northern Ireland basically the same, Scotland basically the same. So there you go. They're very high prevalence rates, partly due to vaccine, partly due to natural infection, and in many cases, of course, a combination of both. Now, just before we look at the data in detail, another thing I wanted to point out: unvaccinated pupils were more likely to become infected with COVID-19 in the autumn 21 term. So this is the end of last year. In fact, this data is up to the 17th of December 2021. So I've been out of date, but there you go. More in Delta times. But compared to unvaccinated pupils, so comparing vaccinated with unvaccinated pupils, those aged 12 to 15 years who'd received one vaccine dose more than 14 days ago, and of course that some would have had more than that, were 23 less likely to report a positive test. So the vaccine efficacy in reducing the likelihood of a positive test is pathetic. 23% were less likely to report a positive test. And of course, this is only a positive test. Not all of those would be symptomatic. And the vast majority that were infected would have minimal symptoms or no symptoms. Some might question why the heck we're bothering to vaccinate that age group with that level of protection. Very low levels of protection indeed. 23% reduction. I mean, as a rule of thumb at the start of this, we said if a vaccine's less than 50%, it ain't no good. And we see this is well under 50%. So quite why we're contradicting our original criteria and persevering with vaccination in this group, at least to me, is a mystery. If you can work it out, then let me know. Now, I want to look at the Office for National Statistics data in a little more detail now, because it does tell us a lot of pretty important stuff. Here we go. So the first one, and again, of course, this is all 10 days out of date now, but it's the best we've got. Percentage testing positive, well, going well up. So the positivity is really quite high in England, over 6%, and is still rising as far as we know. And based on the COVID symptom tracker data, when we get the data next week, this will be even higher. Scotland, even greater increase, positivity in Scotland, about 9%. Really incredibly high. And again, as we believe this is going to be even higher next week, so I would predict a positivity of over 10% next week for Scotland. Northern Ireland. Now, Northern Ireland, quite interesting. Northern Ireland had BA2 earlier than the rest of the UK. Now, that's important because it looks like they're getting over it. So the rest of the UK should follow this trend. So Northern Ireland, if we say that the BA2 is about a week or two ahead of the rest of the United Kingdom, and it's starting to go down already, then I would predict the rest of the UK would start to go down like this. Probably go up next week, as we've said, because of the COVID symptom tracker data. But after that, the sort of width of this up and downy bit should probably be roughly the same shape. I would predict. Now this is BA2. So BA2 in red, BA1 in blue. And we see that BA2 has well and truly become predominant. So both Omicron, of course, but BA2 now much more prevalent in England, nearly 6% of overall cases, whereas 5.4 and 0.9, as you see. Northern Ireland, well, again, we see the BA2 has been higher for longer. The crossover point was actually before this graph in February, but so BA2 now predominant as well in Northern Ireland. And Scotland, well, BA2 obviously the more prevalent, 7.1%, I think largely explaining the high number of cases we are currently seeing in Scotland. Very high levels of BA2. Now, I put this on because the age 50 to 69-year-old age group, there's been a sharp increase in cases, up to 5.6% there of the population. And of course, this age group is more likely to be hospitalised than the younger age group. So that is increasing. So that is somewhat of a concern, even although they are much less likely to be hospitalised, way less likely to be hospitalised than they were, for example, with Delta. And again, in the over 70s, much more likely to be hospitalised, and the prevalence is still increasing. So we're not quite there yet. We've got another week or two before we follow the Northern Ireland downward trajectory, is my prediction. That's what this is looking like. Now, long COVID. Well, there's a lot of it about. Now, this is as of the 31st of January, so this is well into Omicron times. And it looks like Omicron is leading to cases of long COVID. Now, the problem with these cases of long COVID here is it's purely self-reported. So some of these people will be very ill, others will not be, others may well be worried well, and others may just fancy a bit of extra time off work. I'm sure the vast majority are genuine cases, but it just doesn't give us any data. We simply don't know from that. So that's just self-reporting. But it does show 1.5 million, and UK 4-week periods. So self-reporting long COVID, and I think the criteria here is over 12 weeks. So a lot of long COVID. Now these are the symptom profiles that we're getting at the moment from the Office of National Statistics. So cough, about 40% of patients, headache, sore throat, fatigue, and it shows the trend. It shows the trend in the symptomatology, which is really quite interesting as well. Muscle aches, fever, shortness of breath, as we see here, loss of smell, abdominal pain, diarrhea. Now, actually, the most common symptom that we know from the COVID symptom tracker data is, in fact, I've got it here, I think, is actually runny nose. So here we see the COVID symptom tracker data for comparison. And we see that runny nose, 82% of people, then fatigue, then headache, then sore throat. So that's the COVID symptom tracker symptomatology. Now, I will repaste this underneath so you can look at it at leisure. The percentage of people reporting particular symptoms, but runny nose there is the most common. 82% of people that get this infection get the runny nose. So interesting to see the Office for National Statistics data as a comparator. Now, hospital admissions, well, clearly going up, but again, we noticed about 60% of these are hospital admissions are coincidental, that they are admitted for some other reason. Hospital admissions there, as we see, typical age skewing. We don't believe we're seeing a lot of very sick young children, thankfully. A lot of these admissions are precautionary, but they are there. So hospital admissions and deaths, of course, likewise greatly skewed towards the older age group. Now, this is fortunate. Unfortunate that older people are dying, but fortunate that younger people are not dying. Of course, remember in the 1918 pandemic, there was also a predominance of death in late teenagers and young adults particularly. And thankfully, so thankfully, we are not seeing that. We're seeing this linear increase or semi-linear increase with age. Now, moving on to death measures. So these are deaths within 28 days of a positive test result. These are where COVID's mentioned on the death certificate, and these are deaths over and above the usual number, 142,000. So we see that the excess deaths in the UK are actually well below the number of deaths where COVID is certificated. Now, this is unusual in the world. Normally, the excess deaths in Russia, for example, are massively higher, but by several. Well, it's not a laughing matter. It's how bad the statistics are is laughable, but the situation itself, of course, is tragic, where the excess deaths greatly outnumber the official number of COVID deaths. But in the UK, it's the other way around. And I think this is the most accurate number of deaths. So how many people have died in this pandemic as a result of this pandemic? I think that is the most accurate number that we have at the moment. Now, this is also interesting. Now, this graphic here, you might remember this one. Percentage of deaths involving COVID-19 which were due to COVID-19. Now, we see that the deaths due to COVID-19 are still the majority, but we see that dying with COVID as opposed to from COVID is now round about 60%, isn't it? So about 40% of people dying with COVID on the after a positive test. About 40% they're actually dying of something else. The majority still dying of COVID, but about 40% dying with COVID now. And that's an important shift as we do notice the reduced pathogenic effect of Omicron against a vaccinated population. Just as an aside, if you want a bit of a laugh, just type in John Campbell Wikipedia, and you'll see on my Wikipedia page that I've been saying that deaths are only 17% or something rather than 60% or 70%. It's almost like people are deliberately trying to misunderstand. I don't think we could be any clearer, as we've shown this statistic week after week, that the majority of deaths here are from COVID, with a smaller number with COVID. It's interesting, Wikipedia. People can write what they want about me, or you indeed. And who wrote it? I don't know. Do you have any right reply? Not as far as I know. They can say what the heck they want. And it's quite funny that there's so much disinformation about people being accused of, people accusing me of disinformation or misinformation or whatever it is, ladle it out in spades. So have a look at that. It's quite funny. At least I hope you'll think it's funny. I think it's funny. If it does bear any relation to reality, it would be time to pack in, but I don't think it does. You can decide for yourself. Anyway, sorry, I get distracted again. Now, here we have deaths involving COVID-19 increase in the UK. And I put a left in this because of the waves. So there we see the waves. Here's the alpha wave, for example. The original Wuhan strain wave back in 2020. The alpha wave, the delta wave, and the Omicron wave. And we do see that the Omicron wave is higher purely due to the massive prevalence. So not too surprising in some respects. Now, here's the list of the comorbidities. So we see about 17% of people are dying without a specific comorbidity, but that's the minority. Diabetes is still the most common. And then going down, chronic respiratory hypertensive disease, urinary system ischemic heart disease. These are the long-term conditions that are associated premorbidities with COVID fatalities. Now, this is interesting. I put this on because this is the prevalence of people in the 8 to 11-year-old age groups, which in the UK basically we haven't started vaccinating yet. So this is all natural immunity, and we see that it's at 80%, 81%. So we know for sure that is all natural immunity because we don't vaccinate that age group yet in the UK. And this is the massive, glaring hole in the Office for National Statistics data. It is not telling us how many people get symptomatic infection, how many people get hospitalised, and how many people die who've had natural immunity versus vaccine immunity. Why is it not telling us this data? We want to know how effective natural immunity is compared to vaccine-induced immunity, and this Office for National Statistics data, brilliant though it is, superb statistics though it is, there's an elephant in the room, and it's called natural immunity. And the immunity from natural infection, and we're simply not given it, apart from the odd little snippet we can get there, which indicates that it's pretty high. And again, we've got the data from California and New York that's showing that natural immunity, even if someone hasn't been vaccinated, gives more protection than vaccination. Why aren't we allowed to know about this? Don't pretend to be able to answer that one, but it doesn't look like we are allowed to know about it. So in terms of natural immunity, we are still getting the mushroom treatment, unfortunately. We really do have the right to know about this. Why are journalists, where's the investigative journalism? Why aren't investigative journalists bouncing up and down saying, look, how does natural immunity compare to vaccine immunity? Because the limited data we have from the States shows it's better. But the Office for National Statistics doesn't seem to know there's a question there. It's almost as if it's towing an official party line of pro-vaccination. Which we've needed vaccination, but I've been a long-term advocate of individualised care. And if people have core antibodies, if they have envelope antibody and membrane antibody, then is there still an advantage to vaccinating those people? If we had an individualised approach rather than the one-size-fits-all approach, that's probably the big weakness. Anyway, we get an inkling there that indicates that natural immunity is pretty highly prevalent from the children. As we say, highly vaccinated people, that's a pretty self-explanatory slide. Now, this is interesting. Relative increased risk of this one's all cause deaths. I think this one's all cause deaths. Yeah. Relative increased risk of cardiac and all cause related deaths in each of the 6 weeks in the risk period of the most recent vaccine received in the risk period as a whole, right, compared to the baseline period. So this is data for people vaccinated within 12 weeks of the vaccine in the ages 20 to 29. So what we see is that in the first 6 weeks, in this age group, death is less likely to occur in that time period, a lot less likely to occur in that time period, half as likely to occur. But having said that, if it's half as likely to occur there, that's a pretty, and that's the same, that line there's no difference, there's a pretty minimal advantage there. I think we would have to question that, whether that's statistically significant, but death becomes more probable in this period and this period, and we can equate that to the times. So indicating that the overall risk from vaccination, at least in these time periods, is the overall risk of death is less. There slightly more deaths, there slightly more, and there slightly more. So to me, that's not massive evidence for vaccinating the 12 to 29-year-old age groups by any means. It's pretty minimal. And this one here is specific for cardiac deaths, which of course we're worried about. So first 6 weeks, no difference. Week 1, this is broken down by week now, isn't it? Week 1, so the overall there's not much difference. Fewer deaths, more deaths, basically the same. So again, and this is again for this particular age group, the 12 to the 29-year-old age group. So even though there are documented cases of myocarditis that we can say now is caused by the vaccine, what this slide is showing is that there's also a risk of myocarditis, for example, from vaccination. But the advantage there from vaccination overall for the first 6 weeks in terms of myocarditis, well, basically it's on the line. There's essentially no difference, minimally fewer. But that's all the difference that it makes. So would you want to take vaccine to prevent myocarditis? Well, that data is not convincingly saying that. So all this data is good because it allows us to make more informed decisions, but it's not giving us the data of people that are unvaccinated or people that have the hybrid immunity versus people that are vaccinated. Because in the United States, again, people with hybrid immunity, people that have been vaccinated and had the infection, had a lower risk than people that had had the vaccines without infection. And also in the United States data, people with natural immunity who had the infection were more protected against symptomatic disease, hospitalisation, compared to people that were vaccinated. The natural immunity from that data was superior, but we are not allowed to know what that data says in the UK, which I find pretty pathetic, especially in the context of what we're spending on this Office for National Statistics data and how really brilliant it is. You know, it's fantastic data as far as it's got, apart from the bits that it's not telling us, which is a pity. So let's keep that in context. So there we go. I think that's kind of quite interesting, really. The United Kingdom basically is ignoring COVID now. At least in England, it's ignoring COVID, and that's nicely illustrated by this this example of the great and the good all singing, not wearing masks. And overall, this is I think this is a good thing, because as we've said for some time now, I don't see how everyone is not going to be exposed to COVID. So could well be that it's better to be exposed to COVID while you've still got good vaccine coverage, and that seems to be the approach that these people are taking. And given that they are leading people in society, then I suppose leaders should lead. I don't know. But there you go. I'm not knocking it at all. I think natural immunity is the long-term way to go, because you can't keep vaccinating, but it would be nice to have a bit more data, then we could be more definitive. But there you go. So in the United Kingdom, Office for National Statistics data next week should show even more cases, even higher cases. So it's actually going to be higher than 1 in 16 next week, we predict. That is this channel's prediction, based on the symptomatic data now. But the week after that, as per Northern Ireland, the BA2 variant immunity is going to greatly increase immunity, and I'm very hopeful that cases will start going down after that, and this pandemic will become part of the past, and we can start thinking about other things. But for now, thank you for watching.